Hi, Luke Atkins here from the Institute of Sports and Spines. Today I have the Principal Director, Don Williams, talking to me today. So Don, a frequently asked question around the Institute is, where did the meaning of Institute of Sports and Spines come from?
The meaning of the logo developed many years ago. The whole principle behind our clinic was always going to be more than just me. I wanted a team of professionals that were working together to get good outcomes for patients. So we wanted a logo that didn't just reflect something like Don Williams Chiropractic. I wanted it to be more of a group thing. And so the logo and the name don't reflect it's just me. As an institute, we are interested in education, development of both students in a university academic setting and with our patient groups and our other involvement with overseas education. So that was part of how our institute came to the name. Sports and Spines, primary focus of what we do is musculoskeletal health care. So we have sports as athletes that come in, weekend warriors up to professional level, and spines, obviously a lot of the background is from chiropractic and spinal health. When we put our logo together, we wanted it to be multidimensional. So when you look at the shape of the actual logo, it's round, it's on a reflected surface, reflecting the fact that we're a team and we have substance. The colours, white is the colour of purity, black is the colour of definitiveness. Some people have a negative connotation of black, but it's definitive. Blue is a professional colour, yellow is a warming colour. The purple at the base of the logo is the colour of the flower that grew on top of Mount Olympus. It was a colour of a flower, essentially, that never faded, failed, or gave up. And essentially that's the background of what I believe at us as a clinic. When we're treating patients, we're never going to give up. We're always going to try and get the best solution for the patients, get the outcome they're looking for. So that's essentially how the logo came together.
So what got you here today? So what brought you from where you were to where you are now?
Well, my journey became what it is, I suppose, many years ago. I started off in sport. My whole life plan when I was a teenager was pro sport. I wanted to do triathlon professionally. And at that point, I was racing at a national level, and I just thought I was invincible. That was my life. That was what I was going to do for the next 10, 20 years. I had a bad car accident. I got run over by a car. The end result was I had back surgery. I damaged my shoulder. My triathlon career ended essentially instantaneously. So I went from being able to run under 3-minute kilometres in a run to I could take a half a footstep when I left hospital. So it was a fairly demoralising time. I'd probably say I cried for a couple of days straight. I just thought my life was over. There was nothing left to live for. So I went into exercise physiology as an undergrad degree, and my goal when I came out was sports consultancy work. I didn't even know really what that meant, but that seemed like a good idea to me. There really wasn't such an exact career, so I got interested in doing chiropractic. I was treated by a chiropractor who helped me with back pain associated with the accident, and he suggested I tried chiropractic. And I would say at that stage I was somewhat disenchanted with medicine. I had been misdiagnosed with the injury that I had in my back, and as a result of mismanagement from that injury, I had to have the surgery. So I didn't want to go into medicine at that point, so I went and did a master's in chiropractic. And when I finished the master's, I really thought I knew rehab, and then I went and did a sports science program. And then after that, I thought, I really understand the injury mechanisms now, so I really know rehab. And then I went and did a master's of rehab. And the more I learn, the more I realise I still don't know. So it's become a never-ending journey now to essentially try and achieve perfection in diagnosis and management of patients. And that essentially is the basis of how Institute of Sports and Spines came about, as well as how can we create an environment and a team and a dynamic that strives for excellence in education and clinical management of our patients.
So Don, as a chiropractor, I know you treat a lot of conditions. What are some that you do treat?
Well, I suppose I'd answer that in a confusing way. I would probably almost say that I don't really think of myself as a chiropractor anymore. I think of myself as a practitioner who utilises different tools and skills that I have available to me. So I had tools and skills I learnt as an ex-phys, I have tools and skills that I learnt as a chiropractor, and all the other courses and things that I've done over a period of time have evolved that tool set. So I will use manipulation as a tool at times, but it's not the basis of everything that I do. So with the Institute of Sports and Spines, lots of things that come in here for us to see in our chiro rehab team would be viewed as the sort of things that you would often see a physio doing. So we do a lot of post-operative rehab for knees, hips, shoulders. That includes knee replacements, knee arthroscopes. We do a lot of diagnostic assessment of conditions. And we're fortunate to have a very good relationship with a lot of GPs and surgeons, and we treat a lot of GPs, surgeons and physios actually at Institute of Sports and Spines, and they'll often send people to us for assessment, potential diagnosis, and to see if we can get a conservative outcome for a patient so they don't need to go down the surgical path. So we're not anti-medicine, we're not anti-surgery, which some people find a little bit ironic considering some of my history, but I've kind of come full circle now, and I believe surgery has its place in the right circumstances. So our goal is, can we accurately diagnose someone and then manage them, hopefully, in a non-surgical manner, in a conservative way, to get an outcome without them needing to go down that more aggressive path.
So Don, a lot of people around the Institute of Sports and Spines, patients in general, come in asking a lot of times, sometimes jokingly, but sometimes really serious, about who's better, you or Iris?
It is a question that we get asked at times, and sometimes if I'm taking phone calls, I get the same question. People often have this misconception, if you have someone that has been around treating for a long time, and I've obviously been treating people for 20 years now, people then think that, well, this must be the best person to see. I should go and see Don because he's got more experience. And temporarily, time-wise, yes, I have been treating for a long time, but that doesn't mean that Iris doesn't have extremely good skills. So I'm quite confident to get treated by Iris myself. Iris is lecturing at the university in foundations in technique and anatomy, and she's doing some fantastic things, and she's bringing a lot of skill sets to the clinic that I didn't actually have in the first place. So interestingly, you can see two different practitioners, they'll approach the same problem in different ways but get the same outcome. So there's some things that Iris would treat that I wouldn't necessarily treat, and the same on the flip side, I'd treat some things that Iris wouldn't treat. So I would say we would use our skill sets that we bring to the team to bounce off each other and further advance the management of the patient and what we're doing with people in general.
So Don, I'm curious, what is the difference between physio and a chiropractor?
That can be a difficult question. If you get a straight chiro, you can get some chiropractors that all they do is adjust people. And so we call them, in the profession, they get called straighters. Sometimes they get called philosophical-based chiropractors. And all they use is manipulation. Then you get some physios that all they use is EPT, electronic machines, ultrasound, TENS machines, interferential machines, things like that. You get some physios that will do cardiac rehab or slow exercises with geriatric people. And so there's people on the fringes all over the place. And I think at the baseline level, generally speaking, I'd say chiropractors are better with spines, physios are better with muscles. When you get to the more advanced level where you have people who focus in rehabilitation as a specialisation, the lines become extremely blurred. So at our clinic, the first thing that we do is a very comprehensive assessment. And we would say, from our feedback from other practitioners and practitioners that come to us for treatment and for questions regarding their patients, we have one of the most comprehensive new patient assessment protocols in the country. So we thoroughly analyse someone to work out what's going on, what do we need to do to get them where they want to be, and then we will do the rest of our orthopaedic and neurological tests to work out exactly what is the diagnosis, what do we need to do to get a result, what exercise do we need, what treatment modalities do we need to use? Do we use soft tissue work? Do we use manipulation? Do we use shockwave? Do we use exercises? Do we use home strategies to address ergonomics, sleeping postures, things like that? So it's a very comprehensive assessment. And I think at that top level, I know some physios who I think are brilliant as well that do very comprehensive assessments like that. So the boundaries can become very blurred. Some physios will use manipulation as a tool. And at one point in the early 2000s, manipulation was actually the most popular postgraduate qualification for physios. Now I think the most popular is probably dry needling. You see a lot of physios doing dry needling. At the same time, lots of chiros do. Iris has done dry needling. Mahalia is currently doing dry needling on our remedial team. I'm doing dry needling. We have an acupuncturist that does acupuncture, and contrary to some people's popular belief, acupuncture and dry needling are quite different from how they do their needling and how they approach patients. So I think it's a blurred boundary, and what we do with our team at the clinic, it really makes it much harder for people to define the difference. And so often people come in, and I've had some patients who've been my patient for years and have never realised that I was actually a chiropractor until we talk about it one day, and they're talking to someone on the phone. When they come in, they say, I'm at the physio now. And then when they get off the phone, I say, you realise I'm not a physio, I'm a chiro. And it's a shock to them because they never realised, because they'd never asked me about what my actual profession is. And because I often say to people, I'm a chiropractor and an exercise physiologist, but what I really do is focus on rehab. And so that's a hard question to answer, and I hope I've done it justice.
So Don, we've got a new shockwave machine here at the Institute of Sports and Spines. Tell us a little bit about it.
Well, it's a machine we've been thinking about buying for some time. As a clinic, we're very privileged to have been able to do a lot of tests on a lot of different machines and equipment that get brought into us to analyse the impact on patients. We tested a shockwave machine last year, and it still stands as the most effective trial of any equipment that we've ever done in the history of our clinic. We had some profound results with a whole bunch of different tendinopathies, particularly things like plantar fasciitis and shoulder rotator cuff tendinopathies. So it's essentially to be thought of like a super high intensity ultrasound machine. It impacts or pounds essentially the tendon or the irritated lesion, and the whole idea is that it stimulates a response or healing response, so the body starts going back into the healing response again and hopefully pushes it to completion. So it's one of those things, it's not a comfortable treatment. Contrary to some of the literature, it's generally not comfortable. And we try and push it as hard as we can with people to get the fastest impact in the shortest possible time. Generally speaking, 1 or 2 visits will normally give you an indication of whether it's going to have a good outcome. Generally, you only need 3 or 5 treatments, and it will get a good resolution of complaints for most people.